Ladies and gentlemen, the topic of my talk today is embryology of the hand and upper limb. The genesis of the human hand is a marvel of human embryology. The creation of the hand can be traced back to 4 weeks following gestation, when the limb bud appears as a tiny little structure, and over the next 4 weeks, due to certain processes, the entire upper extremity is created. The tiny hand resulting from this process is an immaculately sculptured structure. The need for this talk is to understand the basics of the upper limb formation so that the treating orthopedic surgeon can comprehend congenital anomalies better, and in selected cases, parental counseling can be granted so that the subsequent offsprings are not affected by the limb defects which are genetically transmitted. Insofar as congenital anomalies are concerned, the incidence of all congenital anomalies in newborn babies is 1 to 2%. Out of these total congenital anomalies, 10% are upper limb defects. And you will soon realize that it is these 4 weeks from the age of 4 weeks of gestation, following gestation to 8 weeks following gestation that these anomalies can occur. The process of embryogenesis consists of events concerning position, number, and rotation of the upper limb. If you look at an embryo which is 26 days old, the upper limb is marked here as a tiny little spot or a tiny little bud. Well, this limb bud is nothing but an outgrowth of mesodermal tissue into the overlying ectoderm. And the cells of mesodermal tissue are derived from two sources. First, the somatic mesoderm, which constitutes the muscles, nerves, and the vessels in an individual limb. The other source is the lateral plate mesoderm, where the cells ultimately get transformed into bone, cartilage, and tendons.